Hey everyone, and welcome to the Hormone Genius podcast. Today, Teresa and I have the pleasure of interviewing Kristi Allison. Kristi Allison is a certified nurse midwife, and today we're going to be talking about the hormone genius within pregnancy. So I'm going to share a little bit about Kristi and how I know Kristi. So Kristi was one of our founding board members at Guiding Star Cedar Valley, and she has a huge passion for serving young women and all women of all ages, but specifically within those childbearing years. She is FEM certified and just has a huge drive to be a voice in this area of education and care. So, Kristi, how about you share with our listeners a little bit more about who you are and what gave you that passion?
Yes. First of all, thank you for having me. I have been an avid listener to the Hormone Genius podcast since you ladies started. Like Jamie said, we've known each other for some time, and I've always looked up to Jamie, and she's been a great role model for me. And then with Teresa being in women's health for quite some time, I definitely look up to you as well, Teresa, just with your background knowledge. So it's an honor to be here with both of you today. A little bit about myself. I would say first, I have been married to my husband, Nate, for 11 years. We have 4 children, 3 girls and 1 boy, and they range from 9 down to 1 year old. I love being a mom. I love the pregnancy aspect, the breastfeeding. So naturally, I enjoy carrying that over into my job. So as a certified nurse midwife, which I've been for about 3 years, a little over that at this point, my focus is caring for women from puberty through menopause and beyond. And within that is also the pregnancy care and the postpartum following delivery care. So lots of education goes into it, lots of teaching. Like you had mentioned, I am a FEM medical provider. So I do a lot of working with women to get to the root cause of some abnormalities that we may find, within their monthly cycles. So that's kind of a recap of what I do.
Awesome, Kristi. So I just want to this is a shout out to the nursing profession, because this is what I love about becoming a nurse and then just having this amazing ability to do so many things in the scope of nursing. And what I also love, and you touched on it, Kristi, is just the education piece. So there's something about the way nurses in general are educated in their training that really helps us to be the most holistic type of providers, and the type of providers that listen to patients. And the nurse midwife profession is beautiful for that reason, because women really want that. I mean, we know that childbirth is a natural thing. And so many times, honestly, the complaints that I've heard from sometimes traditional OBGYN and my patient is that they feel like they just don't get enough information. It's kind of your body just does this. No, you don't need to know anything. Just show up, it'll just all happen. And and that might be okay for some women, but so many women desire to know what's happening and how their bodies are going to change and what is the process that I'm going to go through. And I love midwives because they offer that additional support and education to the patient that they really deserve and need.
Yes, and I think as midwives too, we have a big focus on getting to know each woman, because each person has, a different background coming in, different knowledge coming in. And when you really get to know them, you know where to pinpoint that education for them to be able to give that best support. So I think as midwives, that's something that we're really good at.
Kristi, for our listeners, would you describe the difference between a midwife and then OBGYN?
Yes, so similarities would be that OBGYNs also take care of gynecological concerns, and they take care of women during pregnancy. A big difference is that midwives do not take care of the high-risk things. An example would be in pregnancy, like a woman who needs medication like insulin for treating gestational diabetes. We also, as midwives, do not do any type of surgical procedures. kind of alluding to what Teresa said, though, the cool thing about nursing and nurse midwives is there are a lot of different avenues that even as a midwife that you can get additional training in and focus your attention. So some midwives may do additional procedures that are outside of the basic role of a midwife. And that might be, doing a procedure like a colposcopy that may be needed if a woman has an abnormal pap smear. That's just one example, but in general, an OB doctor does more of the high risk and they do surgeries.
Okay.
So I have a question.
Oh, sorry, Teresa.
Yeah, no, do you want to finish that thought?
Well, just a big difference that I like to tell women also is that during their time in our office for a prenatal visit, since we are taking care of normal, low risk, healthy in most cases with some deviations outside of that, we just have a little bit more time, like I said, to get to know them, to educate. I always encourage women to bring their questions because, they're here for that short bit of time during their appointment, and it's so easy to forget things and miss out on some of the things they've been wondering. So just having that touch point during their visits where they know, like, we're here to listen to you, we're here to educate you, to give you anticipatory guidance for what to expect before your next visit. And I just know so many wonderful OBGYN doctors, but they're very busy people doing what they do, and they don't always have that same amount of time that midwives have.
Awesome. So one thing I think I'm just going to put myself in a patient's shoes. So I know when my patients come to me and they're trying to decide, should I go to a doctor or an OBGYN for delivery, or should I choose a midwife? Because of course they talk to their friends and family and they're just trying to decide what's going to be best for them. I could see that some patients might think, if I go to a midwife, I for sure have to do this like all natural, and there isn't going to be any ability to change that decision. Like you were going for, a natural delivery with no pain medication involved. And as far as I know, I don't think that's true, but like, how do you approach that? Because, and on the other end of the spectrum, of course, there are patients that would choose a midwife because that's what they want. They do want to have a pain, a non-interventional delivery in the sense that they don't want, pain medication or an epidural. So what's the approach, would you say, right now in 2021 we're in, for midwives? Because I'm sure it's evolved over the last, 20 to 50 years. So what is kind of the current approach and model of midwifery and how they approach childbirth?
Yes, good question. So in the United States in 2021, it's about 98% of midwives deliver babies in the hospital setting. So that other 2%, that's going to be a home birth setting or a birth center setting. But even though 98% of midwives practice in a hospital, there's a lot of myths surrounding the care that we provide or who is able to see a midwife versus a doctor. And in the community that I'm in, we actually have quite a few midwives and a lot of knowledge within the community from people talking to their friends and family about midwives. And even with that, we get a lot of questions. So when women come to the practice, we initially just tell them, if you are low risk, if you are healthy, we encourage you to see a midwife. And we share with them, what midwives do and why we would encourage that. Now, if someone's preference is just they want to see an OB doctor, that is great. We set that up for them also. But a lot of it, again, goes back to the education, just letting them know that a midwife is here to be with you and support you in what your decision is. And our job is to educate them on what their options are. Let's say, for example, for pain management, we talk through ways to cope naturally, if that's, freedom of movement, ambulation, soaking in the tub. We have massage techniques, different exercises, things that we do on our end to help a woman if they want that. Or we have the ability to teach them about nitrous oxide, IV pain medicine, or talk them through the risks and benefits of an epidural. And then here we've given them the information, they take it, digest it, ask questions. And then when it comes time for labor, again, a lot of times, you might come into it with what you think you want. And then, the midwife is there to be with them, to support them, to go whichever route they want. So yeah, there's myths around that as far as what, do I have to have a natural delivery, no pain medication with a midwife? But that's just something that we teach them early on, that we're there to give them the information, and then it's up to them to decide what is going to be best for them to give them the experience they're looking for.
I love that so much. I think that, as I started learning more about my fertility cycle, then when I became pregnant, that was just as fascinating. So it's just interesting how when you really begin to learn about our womanhood and our, again, the female superpowers, this ability to bear children, it becomes so fascinating. And I do think from my experience, so I saw a midwife with our first, and it was beautiful. She spent the time with me. I didn't feel like she was rushing off or anything like that, but I was thankful to have known that freedom of choice of choosing what's the best way to care for my body in like a judgment-free zone in regards to and that kind of thing. So Kristi, what would you say when we asked you to interview to talk about the genius of hormones in pregnancy, what were some of the things that came to mind right away that most women, I should say, maybe don't even know or realize?
Yeah. Well, I think it's so cool that, at the moment of conception, things change immediately before you even know it, which, is so cool that our bodies can do that. Women who are pregnant, one of the first hormones that we see with that is HCG, or human chorionic gonadotropin. And the reason I bring this one up is because this is the one that, we can test for, and it can be found early on in the blood, as close as 8 days after conception, or like the home pregnancy test done with the urine. That's the hormone that is being tested for. So that is really cool. And right away with that, this hormone is secreted by the placenta. And we know the placenta is so important in pregnancy. And between that, it also helps to maintain what's called the corpus luteum. So when a woman ovulates, there's this shell left behind, and the corpus luteum produces that progesterone. And we know progesterone is so important in pregnancy for a multitude of reasons. But I also like to take time with women to teach them, why they feel some of the symptoms that they feel in pregnancy based on, what this hormone does amongst the other ones. So kind of, I guess that HCG is super important because it helps us with that progesterone, and progesterone is important to help maintain pregnancy. But that level is something that rises through the first trimester, and then it just dramatically drops. At that point, its purpose is kind of through, and then oftentimes, in many cases, the placenta then takes over and produces that progesterone that's important to sustain the pregnancy.
I'm going to stop you because let's talk about it, because I think it's so cool when women really, especially when they've had multiple children, they start to recognize how much like those hormones affect them so early. So what do you see? Because I could come up with lots of them, but like, what are the earliest symptoms? Because women will say like, I knew I was pregnant the day I conceived, or within a few days or a week.
Yeah.
So I don't disagree with that, because there is so many complex changes that already occur at the moment of conception and right after. So what are the common things that women might experience in the earliest moments of pregnancy?
Yes. So I would say most people talk about breast tenderness, fullness. Some people will say, I was walking down the stairs and I just knew. Like I knew I was pregnant because my breasts felt different. They felt tender, and I had never felt that before. Or that's what they had noticed in their last pregnancy and they felt it again. And like you said, Teresa, they noticed this change before we even see that, home pregnancy test that's positive. Women can feel these changes and notice them. So that, I would say, is definitely the first thing that many people talk about.
So I remember my first pregnancy, and I'll never forget, like probably again, before I got my pregnancy test, stepping out of bed one morning and then standing up and feeling like lightheaded.
Oh,
So I think sometimes feeling lightheaded is
Yes.
one that women will experience. The other thing, and I use this literally, I could like, because I've had a lot of babies, I've had 8. So my marker for knowing when I was pregnant, it's so funny too, because it's abnormal, but is acid reflux.
Oh.
So I would like within days of conceiving, all of a sudden I'd be like, oh my gosh, I've got heartburn. I've got heartburn. Why is this happening? I know why it's happening.
You know what's so funny is that I was just having a conversation about this with my friends a few days ago about how, because I'm pregnant now, world, Hormone Genius world. I don't know if we ever made that announcement, but I was planning on it.
Congratulations, Jamie.
I knew that actually.
So I'm pregnant and I am finding myself doing this all the time. I do it right away. Like when I do this before I even take a test, I'm like, oh, I'm totally pregnant. Okay. I don't know if you've ever heard this before, medical professionals listening, Teresa, Kristi, and anyone else. Okay, ready? Okay. I don't know why every single pregnancy this happens. If I'm referring to a month, okay, so like let's say I'm talking about February, I say Tuesday. If I'm saying January, I say Monday. I don't know why. March is Wednesday, April's Thursday, so on and so forth. So I'm in meetings. Like this just happened yesterday. I'm like, and then Tuesday. And they're like, Tuesday? I'm like, I mean February. I don't know why. Isn't that hilarious? I remember.
So weird.
It's so bizarre. And I remember like with my second pregnancy, I did that. It was like a week after conception and I was at work and I was talking to someone and I did that. I'm like, oh my, I'm totally pregnant. I know it. And sure enough, who knows? I could just be this weird. It's totally
There's all
weird,
sorts of
totally
weird
funny.
things that happen in pregnancy that are weird, right, Kristi? There's just like, what's the most unique kind of weird thing that you've ever heard someone say that they had as a symptom?
Oh, I guess I have a funny story. Just last week, this lady came in and she's like, I got out of the shower and my 3-year-old asked me, she's referring to her breast, so my 3-year-old asked me why my pepperonis are getting darker, which, with the estrogen and progesterone in pregnancy, like the areola, it gets darker. There's more like veins that show. And her 3-year-old just said, why are your pepperonis getting dark?
That is awesome. That is very true.
Too cute.
That is a true symptom. You also grow like anything that was already brown to begin with, like moles and stuff, get bigger sometimes and darker. So that's not always fun.
Yeah. So I think the cool thing though about like these breast changes that we're talking about as one of those early things that people can feel is just the fact that our bodies are so cool that like early on that milk duct system is already forming. And I think it's cool to share with women, when they come in for their first visit and they feel that breast tenderness, that their body is making changes to support this baby even after they're born. It's just there's so many levels of really like behind the scenes kind of, we don't see all these things happening, but to point that out and see the light bulb go off, like, wow, if I wasn't interested in breastfeeding before or learning about breastfeeding, now I am because I feel that and that's happening for me, So that's just
it's amazing. I mean, talk about the uterus, Kristi. And I mean, think about how I don't think there's probably any organ in the body that is more incredibly dynamic than the uterus. I mean, someone could argue that probably, but I'm just going to throw it out there. So the uterus, right? The size of like a fist in the reproductive system. And that's where the baby's little home is. We call it the womb, right? But it grows to be, what is it, 1,000 times? Is it 1,000 times its size or is it 100 times its size?
No, that I don't even know, Teresa.
I mean, think about it. It like grows like so huge, like, and
it's really fast.
Yes, in a short amount of time. I'm fascinated by that particular miracle of the woman's body.
That is fascinating. Well, okay, here's a question everyone may be wondering. All right, so obviously when you are pregnant early on, okay, the baby, super tiny, size of a gummy bear, and then the size of a, whatever, next level above. So tiny little thing that's growing. Why does our womb grow so fast when the baby is so tiny? Because again, like exponential growth in the first trimester, big time. I think they say this also could be something I just heard once that I don't know if it's 100% true, but like if the rate of growth continued throughout your full pregnancy at the same rate of the first trimester, like you'd give birth to like a 1-ton whale or something, because there's so much growth in that first trimester. But even still, the tiny little baby is so small. So why is it that women start to show even later on in the first trimester? What's making the uterus grow even though?
Right. So the body is adapting to the pregnancy, and the baby, starts off little and is also growing exponentially. But with that, you also have blood volume changes to support the pregnancy. You have those hormone changes, and that is a big thing too. You've got the placenta that's growing. There's other things within the uterus or the womb, the fluid around the baby, the placenta, the baby. So all of those things, are part of that growth that needs to happen.
And weight gain too. So a lot of women, like they get to the end of pregnancy and they're like, how come I've gained 35 plus pounds and I'm going to deliver a 7-pound baby? Where did that all go? But people don't realize that, your breasts literally, I think, contain 3 to 5 pounds of weight. Your blood volume expands by 50% by the time you're 5 months pregnant. That's an additional weight. A lot of weight is just fluid retention at the end. And
the placenta is about 1/3 the size of a baby on average. So that's another couple pounds,
Yeah. So, but people do wonder, Kristi, about weight gain in pregnancy, and kind of what's your kind of philosophy, or how do you approach just nutrition and what's, a guidance in terms of women and weight gain in pregnancy?
Yeah, good question. So this is something that can be touchy for some women because their body is changing, and it's, something that can be hard to see that for some people. So I do just kind of like to use the guidelines based off of body mass index. So if a woman is a healthy BMI, body mass index, between 18 up to 25, the expected healthy weight gain would be 25 to 35 pounds in pregnancy. Now, if someone would be, under that BMI of 18, we would need them to be gaining more weight to support, or in more cases, we see women whose BMI is higher than that. And then, we really have to do that education on what is the appropriate amount of weight gain. Now, I start with that as a basis, but it's not all about the numbers. A lot of it to me is that I want women to look at food differently than maybe they ever have before. I want them to support their body and nourish their body to be able to grow a healthy baby. So we talk a lot about getting the appropriate amount of protein in their diet, what it looks like to have a colorful diet. A lot of times, we grab things that are fast, and that is just how we have to do things sometimes. But if we're able to grab a string cheese and an apple over a bag of chips, then we need to try to make those changes. And a lot of women that I care for, we also need to think about, their socioeconomic status and what access they have to certain types of foods, and how to get a complete nutritious diet with what they have. So that's really where my education goes on the nutrition side of things. I also am a big advocate for moving their body and just trying to get to the basis of, does that look like walking? Do you like doing yoga? Were you doing strength weight training before? And how can we continue that and talk through when modifications are needed? The goal, I always say, is 3 to 5 times a week, try to move your body and try to make it where, if you can break a sweat or feel like you're out of breath a little bit when you're walking, those are the things that are important to me. And then, checking in on their weight with each visit is not such a big deal. It's not like you're bringing up something bad, because we set the basis for, this is what's best for you and your baby, and we want to support you in reaching these goals so you can have a healthy pregnancy. But again, I will say, as midwives, it's not all about what I want for the patient. I need to get to what her goals are. And then my job is to educate her, support her so she can meet those goals while ultimately having good outcomes for mom and baby.
Cool. I'm going to ask this question that seems unrelated, but it's totally related to pregnancy. But can you share with our listeners what microchimerism is? I know it's a weird word, but
Yeah.
I'm fascinated by it. So I'm going to have Kristi explain it.
Okay. Yeah. So it's an interesting thing. And truthfully, there's a lot more that we need to learn about this, but it's when your body carries the genetic makeup of a different person. So during pregnancy, some of mom's cells go to the baby and vice versa. Some of baby's genetic cells go to the mom. So a small number of cells stay with the baby, like even after they're born. And sometimes it's found into adulthood. Also, a small number of cells stay with the mom from each of her pregnancies. So there can be, like I said, we need more research, but it's when we learn of these things, that's pretty amazing. Because if you think about it, about 1 year ago, I just had my fourth child. So when I was pregnant, I could potentially have had cells from my mother still, and from my 3 previous children and this new baby. Like how cool is that? But then, science-minded people like myself, maybe Teresa, it's like, okay, well, what is the design for this? What is the purpose of this? And that's where it can be cool, because some of these cells are able to travel places, like from the baby can travel places in the mom and protect the mom.
Because don't they also kind of act as like stem cells, right? To help prepare, like if there is a, we talked about this in the miscarriage infant loss episode.
Okay.
Like our baby cells stay with us. It may explain why we feel close to the babies that we lose, but that they can act as stem cells when, if we're having a heart condition or a lung condition or a brain condition. And that's actually how they found out that this was a phenomenon. Was a woman was having surgery in her brain, and they found cells that were not hers, they were that of her son. And so they found that, oh, that's interesting that she has this brain condition, and yet all these cells are accumulated in that one area.
Mm-hmm. Yeah, cool. Another thing with it that I have read before was that we know that having a pregnancy is protective against breast cancer. So they think that this may be why having had a prior pregnancy protects women against breast cancer, because women who have breast cancer have less of these remaining baby cells from prior pregnancies. So isn't it, when you compare women with breast cancer and without?
Yeah.
Cool. Okay, so I guess we'll move on to a little bit different direction. So back to like the childbirth thing. And I liked what you said about how, a lot of times we go into childbirth and we kind of have a plan, and some people really have a plan, and it's like a very, very detailed birth plan. And the way I approach it is I make sure I help women to navigate the fact that this is going to be something that they've never experienced before, and they don't know how their body is going to react. And so to have a plan is a good thing. It is a good thing, but to also know that it's likely not to go as planned on your birth plan is important, because, we have, there's stories of women who I think, and I've seen this, where they wanted like an all natural childbirth, and they had everything like to the dot, to the period at the end of the sentence, like planned out to a T, and then everything goes completely differently than what they thought it would. And it's almost like a birth trauma, because it didn't go the way they thought it was going to be. So I just wonder if you could speak to that a little bit, like to help women who are especially experiencing a first pregnancy and they just don't know what to do. They want to be prepared. What's your guidance just in preparing just for how to approach, having a child for the first time?
Yeah. So I actually like to call a birth plan a dream sheet. And I like to talk about that during, the visits ahead of time. And this is the way they dream and envision exactly the way they want things to go. And a lot of that just opens up communication, because some things might be not super realistic that are on that dream sheet for what we can provide, let's say in a hospital setting. And other things, it's like, yes, of course, we can do this. And it just opens that communication to be able to talk about, what on that dream sheet is reasonable and feasible with what we can do to meet those expectations. So the education, like communicating, just having that discussion, I think is number one of importance, because a lot of times questions arise from that, or it triggers women to look into something a little bit different that, we can talk about that they may not have known was an option. So that I think is first. Secondly, sometimes the plan goes just as women want it to be, and sometimes it is completely the opposite. And in those cases, it's most important for women to feel that they were supported and that they were able to make those decisions that steer in another direction from what they had planned. I always feel like I am giving ladies, 2 or 3 options. And I give them 2 or 3 options that are completely reasonable, safe, all are good plans. And ultimately let them decide. I'm never going to give someone an option or, move forward with something that's not safe for the mom or the baby. But I do think allowing them to have the authority or to be able to speak up, to say, to feel what they want in that moment and what they feel is best.
Absolutely. Yeah. That's super important. And it's really about empowerment, for women, because it's happening to their body, and no one, it's just like, you can't make, can't know what anyone's experiencing unless you walk in their shoes. So every personal delivery is individual and how they experience it. And I can remember, like, the first time I went into pregnancy and delivery, I was a healthcare provider. So maybe I was like, I should know everything, but I didn't, so I'm like, I'm just going to go in and I'm going to wing it. Winging it, it's probably okay for some people, maybe not. And I thought my mom had natural childbirth. So I was like, I'm going to go in there and I'm just going to try that out. That whole natural childbirth thing. Probably should have prepared a little bit more. And, it was fine, but here's the key. I had no one to advocate for me. And this is why I think midwives are so important. But I got to the very end through transition and I was like, okay, I can't do this anymore, but nobody told me I was in transition. Mm-hmm. And so I was like, okay, if this is going to go on for hours, I don't think I can do this. And so I was like, I think I need an epidural. And so they put the epidural in and then they're like, okay, lay back down. They're like, oh, it's time to push. Mm-hmm. And I was like, what just happened?
Yeah.
I'm like, no one told me I was that close. Yeah. And so if I just would have, I should have advocated for myself, but this is again important with having someone there to advocate for you and that knows the birth process. It's so helpful. So with my next delivery, I'll never forget. I told my husband, I'm like, tell them I don't want an epidural. And if I say I do, just tell them I don't anyway. And I remember he walked in the hospital with the second one. He was like, she doesn't want an epidural. Don't even try to talk her into it.
He got that out of there right away.
Oh my gosh, what a total jerk, total jerk. But I almost needed someone to advocate for, me to just be like, you can do this. And I needed him to kind of stand up to that. So, I had 6 natural childbirths after that. But anyway, I just love that midwives can offer that. And that's not to say that OBGYNs cannot do that. And I just want to say that because I know great OBGYNs that offer absolutely incredible support in the exact same way that a midwife can. So that's not to say that an OBGYN cannot do that. It's just, again, there is something about the way you're educated as a midwife that just naturally inclines you to do that.
So Kristi, so let's walk through this process. So woman conceives, pregnant, okay, moving on throughout her pregnancy, and now she's delivering, she has her baby. And then what would you say is like the very most important thing to consider for the mother right after she has her baby in regards to that bonding, or even with like the placenta and all of that?
Yeah, good question. So I am a huge advocate for skin to skin. So I often say, I am the one who catches the baby, but they're in my hands for just a moment, because as fast as I, make sure that they arrive safely into my hands, that baby is up on mommy's belly. And I think the sooner that she can see her baby and, look at all those little features and smell her baby and hear that cry, and those are the initial steps of bonding. And that's for mom and on baby's end. Mm-hmm. So that I think is ultimately important. And then we go into, that moment and leads into the golden hour, which is also something that we encourage to help promote bonding and breastfeeding. But when a baby is skin to skin with mom, it helps them to regulate their temperature, their breathing, their blood sugars, and helps to facilitate that bonding. So there's so many good things that come from keeping mom and baby as a unit and keeping that as interrupted as possible within that first hour.
It's so fascinating. And can't the baby can like smell where milk comes from too, right? So then it's like baby army crawls up to the mom and starts to nurse right away. I think that's beautiful that they're so keen in on that. So beautiful.
Yeah.
Oh my gosh.
Yeah. And the other cool thing too, just kind of talking with breastfeeding and baby doing the breast crawl, is there is just a sudden shift of hormones after the baby is born. You go from having this, higher estrogen, progesterone base to that dramatically drops. And then we're getting the oxytocin rise, which oxytocin is responsible. It's called the love hormone, helps a lot with bonding. And then we have, as that placenta shears away and is delivered, then we have this increase in prolactin. And prolactin is what helps us with the milk production, whereas then we have that oxytocin, the love hormone, that helps with the letdown. So between both of them, having mom close to her, there's just this contentment, there's this love. It's like a euphoric feeling. And to me, I've felt that with my babies, but also to be able to witness that, it's just, that initial time, it's holy. Yeah. It is. It's just, I want to sit there, be quiet, let mom, baby, and, dad have that moment. Because you don't get that time back, and that you get this one shot at it, and it is so special.
That's so special. That is beautiful. And this is going to ruin the moment, but letdown is crazy. That's right. Totally. I'm going to ruin the moment here, but that letdown thing is just insane. And what it feels like, but just that bodies produce milk and can do so and nourish a child without anything else. I mean, crazy. It's just amazing that happens, and immediately the whole process starts. So we don't often take a moment to even, just in awe of everything that happens around pregnancy, delivery, and breastfeeding. All of that is just incredibly sacred, like you said.
Mm-hmm. Oh my gosh, Kristi, I feel like we need another episode to talk about breast milk and breastfeeding. Oh my gosh, because our time is kind of coming to a close here. Teresa, do you have any last questions before I ask Kristi our final question here? I feel like we're cutting us a little short, but what would you say? Teresa, any other last questions?
I don't think so. Not off the top of my head. So, but I might, as you ask the last questions, we'll see.
Kristi, you are amazing. You are so amazing. I have 10 more questions I want to ask you about breastfeeding, about bonding, about dad skin to skin time, and all of that, but that'll have to come later. If we do get questions though from our listeners, I'll be sure to forward them on or keep a little archival, and then maybe we could do part 2 or something.
But I'm happy to.
Yes, thank you. Okay, so Kristi, what do you wish every young woman knew about her hormone genius?
I think if we take this into the direction of pregnancy, I think women hear so many stories, and some are good, some are bad, but ultimately I want women to know their body was made good. It was made to carry this baby. It was made to be pregnant, and just to trust that. and not let, the noise of the bad things that some people share, the stories, overpower knowing that you were made good. Your body was made to do this. You can do this. You are strong.
Yeah.
That would be my message.
I love that, Kristi, because that's true. We get mixed messages on that moment, even of delivery. There's fear surrounding that, but just imagine that experience for most women if they go in with just a different perspective, about that day. It would change a lot.
Yeah, don't watch TLC, the baby story.
No, it doesn't happen in 30 minutes.
In my first pregnancy, I was on bed rest for 2.5 months, and I would go to my mom's house and watch TLC. You guys are probably listening. You're too old to know what TLC is. It was like
I loved that show when I was little. Loved it.
Yeah, and you're like all these women going in having natural childbirth, and they're like screaming. And my mom would come in and she'd be like, "Why are you watching this? Don't watch this." And I'm like, "But it's so fascinating." And it was still beautiful. There was so many, and I love. Okay, I'm gonna keep it going just a little bit longer. What I love about this is it's like, there's no other thing in life where you choose to go into suffering and come out on an experience of joy in a matter of a short amount of time like that. Like, most of us don't choose pain, but pregnancy is just something that women, get to experience in an incredible way, but pain is involved. There's no doubt. But in no other place in human conditions do we ever like go into the suffering and come out on an experience of joy that can be, nothing else compared. It's a miracle. And I love that. And you can see it in every baby story, no matter how much the woman screamed. In the end, she was in complete joy within seconds of being in pain. And that is an incredible thing to see.
Yes, absolutely. And just even that newborn baby, but then also that newborn mother, now that mom is in a sense born, which I've heard that before. And I love that visual. Kristi, thank you so much for spending this time with us and sharing all the facts and things that you know about the Hormone Genius in pregnancy. And God bless you for all the work that you do. You have such an important job. And every woman you serve is incredibly blessed to have you as their midwife. And I've heard so many beautiful stories with their experiences with you, Kristi. So I know that for sure. So thank you for doing what you do. And thank you for sharing the Hormone Genius with all of your patients. And we will catch all of our listeners later. Please feel free to share this episode with your friends. All right. Thanks, guys.